there are multiple problems which are non-cancerous, like they may be in the form of solid lumps, which is fibroadenomas, benign phylloid tumors. There may be cystic lumps or fluid-filled lumps, which are called cysts. There may be infection in the form of abscess, which can also feel like a lump, like a lactational abscess. Apart from that, there may be nipple discharge, which may be watery or blood-stained discharge. Patient may present as pain and swelling of the breast, which may be a sign of mastitis. This mastitis may be simple infection or granulomatous mastitis, or there is another entity which is called idiopathic granulomatous mastitis. Another problem which is fairly common is pain and swelling of the breast, which commonly we call as fibrocystic disease of the breast. Why these diseases occur? It's difficult to define one cause because every disease is different. The non-cancerous conditions in fact are much more common than the cancer. Like the breast lumps, almost 90% breast lumps which occur are not cancer. The cancerous lumps are less than 10%. Pain and swelling, what we call as fibrocystic disease, probably the 50% of the female population sometimes experiences this problem in their lifetime. Nipple discharge and inversion of nipple are not that common problems. Of course, we are seeing a lot of lactational abscesses. During the lactation period, the milk gets blocked and then there is an infection and causes lactational abscess. They are also fairly common. These non-cancerous conditions, since they are different conditions, every condition has a different symptoms. Like fibroadenoma or benign phylloid, they usually present as a painless lump. Of course, there may be an associated pain in the breast, and sometimes even a fibroadenoma can be painful. Then the cystic lumps are painful lumps most of the time, but again they may be painless. The nipple discharge, the patient may complain of nipple discharge either on the pressing only, or there may be a spontaneous discharge, which is a painless discharge. Of course, the lactational abscess is associated with pain, fever, redness and swelling of the breast. Benign breast lesions or non-cancerous lesions by and large are not fatal. They can be treated, some of them by surgery, some of them by medicines, and most of the time they do not recur. But one thing I will like to clarify, that suppose I have treated a benign breast lump as fibroadenoma, this lump is unlikely to recur, but since breast is there may be appearance of a second lump or a third lump in the following next few years. So don't take it as a recurrence, it may be a second lump. Most of the time they do not cause threatening to the life and can be treated well.